Narayana Nethralaya. I'm part of the retina services here. It gives me a great pleasure to introduce to you our chairman, Dr. Bhujang Shetty. I'm sure all of you all have heard a lot about him. He's an alumnus of the Bangalore Medical College. He had a great vision to grow, foresight to anticipate future needs, and an enthusiasm to develop a robust eye care, which is why he started Narayana Nethralaya. Now, having accomplished so much as an ophthalmologist and an eye specialist, he has seen the different ways in which diabetes can affect our eyes and our overall health, which is why he is now on a crusade to help our patients, to help the community to reverse diabetes in a sustainable manner in which you can do it at your pace, your convenience, and at your home itself. So today he'll be telling us briefly about how one can reverse diabetes by managing our sugars more effectively. So we will have a brief introduction of the concept about how to go about it. And Dr. Bhujang Shetty is also going to talk about his personal experience and how he has gained from adopting this change in lifestyle. Once he gives us an overview of the entire process, we'll open the forum for questions. You can either raise your hand, you will be unmuted to ask your questions if you want to ask yourself, or you can type in the chat box. We will take those questions. Over to you, sir.
Oh, thank you, Chaitra. First, I'd like to thank all of you who have already joined us in this session. This is actually the fourth interactive session we are having, but it's the first time that we are doing it online. Last three sessions were offline. We had personal meetings at our hospital itself. And but some people who are living out of town and some other city, they express that, it's difficult for them to come over. Why not have at least once in a way online programs? Because number of people outside the city and some even outside the country are following this kind of a lifestyle, low-carb lifestyle. So I said to have them all on board. This month we'll have it online. That's the reason why we are having it online this time, so that we could have more participants. First I want to share with you our latest numbers. Just a minute, I'm trying to get that. Yeah, are you able to see this? Patients enrolled? Are we on the?
Yes, sir.
Yes, it's fine. Yeah. So far in the last 7 to 8 months, we have had around 2,300 and odd patients.
So can we go into presentation mode, sir?
Presentation mode. Okay. Yes. I think that's better. All right.
Yes, sir.
Yeah, sorry. So here you have the numbers that we are handling now. Around over 2,300 people have enrolled for primarily to reverse diabetes. And those who have been reviewed just till last month was around 1,400, almost half of them. The average weight loss is around 2 to 3 kgs per month for the whole set. And number of patients on insulin were 299. And amongst them, more than 71 of them have completely gone off insulin. Insulin is one of the first drugs that we remove as they follow this low-carb diet, because this low-carb diet immediately reduces your sugar so much that we are worried that you would go into hypoglycemia. So that's the one we cut off first, and 71 of them have completely gone off insulin. And those who have reduced their medication by half, almost 1,000 people were able to reduce their medication by half after taking up this low-carb, healthy fat diet. And I'm happy to say that more than 365 patients, 366 to be specific, have completely gone off medication. In my 40 years of practice, I have never heard of anybody going off medications as far as diabetes is concerned. The main aim of a doctor or a physician is to get the diabetes under control. But here we have a number of people who have simply gone off insulin, and almost more than 360 people have completely gone off medicine. This is the magic of this low carb diet, because we are addressing the root cause. The cause for diabetes and high sugar is that when a person who's intolerant to carbohydrates keeps eating carbohydrates on one side, will definitely require more and more medicine as days go along. That's exactly what's happening. Initially period, when they test you and find that you're a diabetic, they'll say, okay, stay away from sugars, but you can eat brown rice, chapati, and all that. But unfortunately, we all forget that all the grains, whether it is white or brown, all grains, that is rice, wheat, ragi, millet, and all of them have, ultimately they go into the blood as glucose. So if we are going to eat this morning, noon, and night, especially in our Indian context, we eat the official recommended diet for carbohydrate is around 50% of your calories must come from there. That itself is being challenged now, because that's too much. But when you are a diabetic, we say that needs to be cut down. But then how do you cut down? Because our breakfast consists of, dosa and idli and whatever, everything made from grains. It's almost 100% carbohydrates. Especially vegetarians, there, although the recommended is 50%, our daily intake of carbohydrate is 60 to 70%. No wonder India is becoming the diabetic capital of the world. Indians have average age of heart attacks are 45, whereas in the West it is 65. That's because we eat way too much grains and carbs. So here we tell people that of course, sugar is poison. I'll tell you why in a moment. But the hidden sugars in grains are the cause, because we think we are on a healthy diet, but we are not. They go into the body as glucose, and that keeps rising your sugars. So every time you meet your doctor 6 months to 1 year, he keeps increasing your tablets because your sugars are not under control. That's how it goes from 1 tablet to 2, 2 to 3, 4, 5, and then they say, well, you're on maximum medical therapy, now you need to go on insulin. That's how people end up with insulin. That's a very sorry state of affairs. But whereas you just control these grains, and we have given, and we will give you good alternatives. We are not going to say that, you should go hungry all the time and, don't eat full or any such things. We say eat to satiety. Don't count calories, but eat the right food. And then you will see the magic happening. So this is what's happened in so many of these patients. Very, very encouraging. And I'm sure some of you, or most of you are in this program. You could also, join us and give your experience as we go along. That's what we are here for. Not only that, tell us any problems that you're facing, roadblocks, bottlenecks, and any suggestions you all have. We'll be very happy to give you some answers for that. Now, just a moment. Please bear with me. I'm not very tech savvy, so I'm struggling a little. I just want to, and I'm obsessed about the sugars. So I thought I'll come to this slide. People think that, sugar is innocuous, sugar is harmless. It is, everybody loves it, and we love to feed people with that. And that's why I keep telling my wife, never love anybody through the stomach. This is a problem. We celebrate everything through sugars. But I want you all to know, I keep repeating this. I've recently even, put up a video regarding the dangers of sugar, that Though sugar is sweet but to the tongue, but it is very, very bitter for our health. Because sugars have just empty calories, absolutely nothing more. And it has no micronutrients like vitamins and minerals. We have to, and sugar is not an essential nutrient. We can live without it. Any number of amount of sugar that we require, our body can make it. So we need not worry, oh, if I don't eat sugar, how will my brain run, or how will how will I get energy? There are so many other sources. Because of this excess of sugars, we have got into this trouble. Well, here you have what are the problems that sugar can cause. I tell you, friends, that sugar is the root cause of all the so-called modern diseases, all of them. I have mentioned maybe about 8, 10 here, almost, you can say, any modern disease that you take. It's called modern metabolic disease. At the root of it is excessive sugar intake. But it doesn't happen overnight, so people don't feel it. They said, everybody loves sugar, everybody loves sweet, and so we keep offering sweet for birthdays, anniversaries, success, any celebration, any festival. It is celebrated with sweets and more sweets. So simple things like, initially what happens, you tend to gain weight. But not to say that people who do not gain weight or who are of normal weight, they could be metabolically well, not 100% of them. 20% of the people you've seen, very thin people having very high cholesterol, having diabetes, having blood pressure. So 20% of the people who are normal weight or even below normal weight could be metabolically sick, because the fat that is unseen, that is the inner fat, that's called the visceral fat, is more important than the fat that is seen. That is the outer one. So you could be fit on the outside but unfit on the inside. We must realize that. So don't take it for granted that I am normal weight, why should I bother? You could be having what's called visceral obesity, and it's the visceral obesity, that means the fat around your liver, your heart, your kidneys, your pancreas and intestine, that kills people. We have seen lots of people, film stars and all that, who are fit on the outside, drop dead on the stage. This is what happens, because they are fit on the outside but unfit on the inside. So, but 80% of the people with obesity definitely have what is called the fat inside, and they are very prone. So initial stages, slowly. So this all creeps in over a period of 5, 10, 15, 20 years. So you don't feel it. So that's why we call it a slow, sweet poison. So you slowly, gradually keep putting weight, especially if you have a pot belly. Pot belly definitely indicates that you have got visceral fat, and you have to be careful at that stage. But we keep eating the same stuff. Then slowly you realize that you've got high blood pressure. Then slowly you test your bloods and you have high cholesterols. At that stage, you could have a cardiac event also, or you could soon then be declared pre-diabetic. So we always think pre-diabetes, okay, just maybe I may go in. No, that's about almost the last stage. Actually, the first stage of diabetes, I feel, is when you start putting on weight. That itself, you must be careful. So don't wait to be declared a diabetic when your HbA1c goes above 6.5 for you to wake up and start your diet. That'll be too late, actually. So when you start putting on little weight as you grow with all your regular, we all are very conscious. We do regular exercises and all that, but still you get a pot belly and you put on weight. That means you've already become insulin resistant, and that's the first stage. And then, as I told you, hypertension and all these things come. So you have to be aware when obesity, hypertension, diabetes, strokes, dementia. See, we all think it comes, in 70s, 80s, dementia. Why bother about it? But actually, you must have heard about Alzheimer's disease, Parkinsonism, strokes, and the rest. And the root cause of all this is excess sugars that we have taken, and the insulin resistance that we have developed. And so much so that Alzheimer's is today labeled by some scientists as type 3 diabetes. Although there is so much of excessive sugar running all over the body, but because the brain cells have developed insulin resistance, they are not getting sufficient energy. So that's how they get affected. They die and they shrink, and then your memory comes down. There's mental fog. Then you keep forgetting. That's how Alzheimer's usually develops. So now the thinking is especially if you can, because sugars can't get into the brain, there's another energy. That's what we're talking about, ketones. That's why from the word ketosis, ketone comes from. That energy, by burning fats, that energy can definitely get into your brain and feed it, and you could regain or you could even prevent these diseases. So sugar also causes premature aging. If you do not want, wrinkles, you better avoid it. Or if you take away sugars from your life, you could reverse your aging. And simple things like migraine, your tooth caries and infertility, you name it and you have it, including cancers. I keep saying almost all the cancers, I don't know if you're aware that cancer cells have to, multiply and develop 100 times faster than normal cells. So they need 100, 200 times more energy. And they have a sweet tooth. The only kind of energy they love and eat is the glucose. If you could reduce your glucose intake and starve these cells, the chances of them multiplying are less. Chances of that spreading definitely is less. So I'm not saying that it should be the primary treatment. You take a regular treatment along this, you put yourself on a very low carb diet and sugars, absolutely no sugars. I'm sure that will help. And we say immunity. The last 2 years, we've been always talking about immunity. We know all the people who got sick and got into the hospital, ICU, and even passed away. We say they all had comorbidities. These are the comorbidities that we are talking about. And the root cause of all these comorbidities is sugar. Even in a normal person, well, healthy and normal, if you give them big amounts of sugar, their white cell activity comes down dramatically for about 6 hours. That means immunity reduces. So forget about increasing immunity. Please don't reduce your immunity by taking these sugars and sweets. That's what I'm trying to say. All right. Well, one other thing I just want to tell you all is that, why we should worry about sugars. It's just not about our health. No, we are putting our children into very big risk by giving them excess of sugars. Fortunately, when we grew up, maybe we didn't have so much of opportunities, so much of advertising, so much of TV news to, get all these sweets, and, they are so addictive. Children see it, and you store everything in your fridge, your colas, the cakes, and, your cookies, and all these bakery products. They are filled with all these dangerous foods. That is, they have refined carbs, they have refined sugars, they have refined oils. That's a deadly combination. And our house is filled with that. Our refrigerator is filled with that. And every time a child wants a snack, we just give them some, biscuit or some chocolate or bakery because a child loves it. We are forgetting that we are feeding these children literally with poison. We are feeding our children to death, because now it is known that even children in their teens have developed fatty liver, which is once a disease of the aged. The commonest cause of fatty liver when I was a student was alcoholic fatty liver. We never heard of non-alcoholic fatty liver. Today, the commonest cause is non-alcoholic fatty liver, and the cause for that is sugars. And so no wonder children are now, every fourth child has got a fatty liver, or is obese rather, and every 10th child has got a fatty liver. And you see diabetes in the 20s, and heart attacks in the 30s. That's a very sad thing. And the cause is just one. This is excessive sugars that we have been taking. And I keep telling that it's an addictive substance, like tobacco, like your alcohol, like drugs. It causes addiction. Once they become addicted, however you try to keep them away from children, it will force them to eat more and more of it. So don't encourage children to have these chocolates. Keep it away from their reach. Keep it away from your house, and see that give them healthy food like eggs and good healthy fats, so that they feel full and satiated. They are not running after sweets all the time, because you are directly, indirectly putting these children into trouble. And it's been shown that our sugar intake has gone up by 400% in the last 40 years. That means any person who is about 20 years hearing this has already eaten his quota of sugars for till he's 80 years. So there is absolutely no scope for more sugars. So that's why I say, kindly get sugar out of your life. Excess of sugar, as I said, makes children fat, sick, leading to diabetes and fatty liver at a younger age. Sugar is the new tobacco. Actually, last generation, we waged a war against tobacco, and actually we won it. At least now officially it's labeled dangerous, causes cancer and the rest. Now we need to wage a war against sugar, because sugar is the root cause of all evil. If this trend of feeding children so much of sugar continues, for the first time in human history, the younger generation will have a shorter lifespan than our generation. Because you see now, people are getting heart attacks in the 30s and diabetes in the 20s. What is the reason? So let's get sugar out of our life. And also, don't think sugar is just harmless, innocuous. It is toxic, it is dangerous, it is a slow poison, and we need to take it out of our life. There, of course, you have a number of names. We buy a lot of these processed foods and we outsource our kitchen. And so anything that, when we buy food outside, they would like to make it tasty. Since now the thing, the official guideline says, and everybody believes that fat is the culprit. So they've made it low fat, but to make it tasty, they bring sugar in through the back door. Everybody knows sugar is also equally bad. But then there are so many hidden names in all our processed foods. And then when we outsource our kitchen, it's very easy. Instead of come home at 7 o'clock, who's going to cook? Just order a Swiggy and you get food home. This is another big problem that's taking place now. When we get food from outside, they use, as I told you earlier, refined carbs, refined sugars, and refined fats, which makes a deadly combination. So kindly avoid sugars at any cost. And what I'd like to say is that it's not only for diabetics. If you are a diabetic, definitely sugar is poison. Just take it. That's the period, finished. But if you're a pre-diabetic, people say, I'm just a pre-diabetic. People don't take it seriously. That's the time you need to get off sugar. If you have a family history of diabetes, or if you do not want to become a diabetic, get sugar out of your life, period. That's all. Okay, there I made my introductory remarks. And now, Chaitra, if there are some questions they would like to interact, I'll be happy to.
Sure, sir. So there are already a couple of questions in the chat box. So one, Mr. Yashwant Rao, he wants to know that he's first of all a diabetic for the last 19 years. He's insulin dependent. He's a 74-year-old male. He wants to know that after a workout, mainly exercises like sit-up, push-ups, abdominal crunches, planks, his sugar levels shoot up for about 120 to 140 range to levels like above 200. And it stays there for an hour or two. So he wants to know if he should be concerned about this and what exercises should he do that will not raise his blood sugars. He's also been with RDC since 27th of July, and his dose of the treatment has already started coming down.
Yeah. That's good to hear that, your tablets are coming down. But as I said, exercises are extremely good. I'm not trying to say that, you just eat the right food and, don't do anything. No, you have to exercise. But you could never outrun a bad diet. So I can easily say that, if diet will form maybe around 70% or solve your problem, the other 20 to 30% will be exercise, reducing stress and getting good sleep. So you need not do very heavy exercises. You could do moderate exercises. You could have a brisk walk for half an hour to 45 minutes, maybe 5 times a week. But even muscle strengthening exercises are good. You need not worry. See, the sudden temporary shooting up of your sugars is a body's response. So you really have no control over that. But once you do this for the whole day, your muscles are well exercised. They tend to take up the sugar, and overall better control of sugars you'll have. So you need not worry. Just keep doing regular exercises. Keep having, most important is a very low carb as advised, and you give it some time. It will gradually come down. Need not worry. But I do not want you to stop exercise. Exercise is a must. You must do it.
Next, we have one Mr. Ramu BS. I'm just going to unmute him. He's going to ask your question, sir.
Okay.
Mr. Ramu, please go ahead.
Hello.
Yes, Mr. Ramu. Tell me,
sir. ನಾನು ಏಪ್ರಿಲ್ ಇಂದ ಇಲ್ಲಿ ಟ್ರೀಟ್ಮೆಂಟ್ ತೊಂತಿದ್ದೆ. ಸರ್ ನಮ್ಗೆ ಸ್ಟಾರ್ಟಿಂಗ್ ಬಂದಾಗ ಅಲ್ಲಿ 0.9 ಇತ್ತು ಕ್ರಿಯಾಟಿನ್. ಈಗ ಲಾಸ್ಟ್ ಮೊನ್ನೆ ತಿಂಗಳು ಚೆಕ್ ಮಾಡಿದಾಗ 1.4 ಆಯ್ತು. 10 days ಕ್ರಿಯಾಟಿನ್ ತಿರ್ಗಾ ಟೆಸ್ಟ್ ಮಾಡಿಸಿದಕ್ಕೆ 1.3 ಆಯ್ತು. ಯಾಕೆ ಸರ್ ಜಾಸ್ತಿ ಆಗಿದೆ?
ಕ್ರಿಯಾಟಿನಿನ್ ಎಷ್ಟಿತ್ತು ಹೇಳಿದ್ರಿ ಫಸ್ಟ್?
ಸರ್ ಸ್ಟಾರ್ಟಿಂಗ್ 0.9 ಇತ್ತು.
ಹಾ,
ಲಾಸ್ಟ್ 3 months ಆದ್ಮೇಲೆ 1.4 ಬಂತು. ತಿರ್ಗಾ 10 days ಬಿಟ್ಕೊಂಡು ಚೆಕ್ ಮಾಡಿಸಿ ತಿರ್ಗಾ 1.3 ಆಯ್ತು. ಯಾಕೆ ಸರ್ ಅದು ಆ ತರ ಆಗಿದೆ?
ಸಿ ಯೂಶಲಿ ಕ್ರಿಯಾಟಿನಿನ್ ನೀವು ಒಂದು ಕೆಲಸ ಮಾಡಬೇಕು, ಮಸ್ಟ್ ಟೆಸ್ಟ್ ಇಟ್ ಇನ್ ದ ಸೇಮ್ ಲ್ಯಾಬ್, ಬಿಕಾಸ್ ಸಮಟೈಮ್ಸ್
ನಿಮ್ ಲ್ಯಾಬ್ ಅಲ್ಲೇ ಮಾಡ್ತೀವಿ ಸರ್, ಅಲ್ಲೇ
ಓಕೆ. ಸೊ ನೀ ನಾಟ್ ವರಿ, ಬಿಕಾಸ್ ನಾನು ಐ ಟು ಹ್ಯಾಡ್ ಆಕ್ಚುಲಿ ಬಿಫೋರ್ ಸ್ಟಾರ್ಟಿಂಗ್ ಮೈ ಕ್ರಿಯಾಟಿನಿನ್ ಇಸ್ 1.5, because I've been having a diabetic for more than 25 years. I started this diet not to reduce my creatinine. I didn't know about it. But after this diet, within 3-4 months, now my creatinine is almost 1. That means it has come down. It will take some time to stabilize. You need not worry regarding this creatinine. And the 1.2, 1.3 creatinine is within normal limits. Only if you cross over 1.5 or 6, you need to worry. So it will stabilize with time. But
sir, ಅದೀಗ ತಿರ್ಗಾ ಇನ್ನ ಜಾಸ್ತಿ ಆಗೋದ್ರೆ ಅಂತಾನೆ ನನಗೆ ಭಯ ಆಗ್ತಿರೋದು ಸರ್.
ಇಲ್ಲ, ನೀವು ಮೇಬಿ ಆಫ್ಟರ್ ಅ ಮಂತ್ ಆರ್ ಸೊ ಯು ಚೆಕ್ ಅಗೈನ್, ಯು ಜಸ್ಟ್ ಸಿ ಇಟ್ ಇಸ್ ಕಮಿಂಗ್ ಡೌನ್. ಲಾಸ್ಟ್ ಟೈಮ್ ನೋಡಿದ 1.4 ಇಂದ 1.3 ಬಂತಲ್ಲ.
ಹೌದು ಸರ್,
ಡೆಫಿನೆಟ್ಲಿ ಕಮ್ ಡೌನ್. ದೇರ್
ಸರ್ ಅವಾಗ ಏನಾಗಿತ್ತು ಅಂದ್ರೆ ಕೀಟೋಫ್ಲೈ ಅನ್ಬಿಟ್ಟು ಅದು ಆನ್ಲೈನ್ ಇಂದ ತಸ್ಕೊಂಡು ಯೂಸ್ ಮಾಡ್ತಿದ್ದೆ. ತಿರ್ಗಾ ಲಾಸ್ಟ್ 3 months ಬಂದಾಗ ಅಲ್ಲಿ ಕ್ಯಾಂಟೀನ್ ಅಲ್ಲಿ ತಗೊಂಬಂದೆ. ಆ 10 days ಏನಾದ್ರು ಆಫ್ ಫ್ಲೋರ್ ಯೂಸ್ ಮಾಡಿರೋದ್ರಿಂದ ಏನಾದ್ರು ಆಯ್ತು ಸರ್ ಆತರ?
ಇಲ್ಲ, ಈ ಫ್ಲೋರ್ ಇಂದ ಏನು ಆಗೋದಿಲ್ಲ ಸರ್ ಕಿಡ್ನಿಗೆ. ಇದಕ್ಕೆ ಏನಾಗುತ್ತೆ, ನಿಮ್ದು ಶುಗರ್ಸ್ ಎಲ್ಲ ಹೇಗಿದೆ ಇವಾಗ?
ಸರ್ ನಾನು ಅಲ್ಲಿ ಬರ್ಬೇಕಾದ್ರೆ 6.3 ಇತ್ತು, ಬಟ್ ಟ್ಯಾಬ್ಲೆಟ್ ಬಿಟ್ಬಿಡು ಅಂದ್ರೆ ಟ್ಯಾಬ್ಲೆಟ್ ಬಿಟ್ ಮಾಡಿದ್ರು 6.3 ಇದೆ. HbA1c ನಾರ್ಮಲ್ ಇದೆ, ಏನ್ ಪ್ರಾಬ್ಲಮ್ ಏನಿಲ್ಲ.
That's great ಅಲ್ವಾ? Without tablets you are having 6.3 ಅಂತ ಹೇಳಿದ್ರೆ below diabetic level, you are in the pre-diabetic stage now. I would like you that you go as low as 5.5 and within a few months you will, and then you ನೋಡಿ ಹೇಗಾಗುತ್ತೆ ಈ ಕಿಡ್ನಿದು ಮತ್ತೆ ಈ ಹಾರ್ಟ್. Of course we don't have any indicators, but there are other indicators for heart. ನಿಮ್ದು ಕೊಲೆಸ್ಟ್ರಾಲ್ ಲೆವೆಲ್ಸ್ ಅದೆಲ್ಲ ಅದು 3 months ಆದ್ಮೇಲೆ ಚೆಕ್ ಮಾಡಿದ್ರೆ you will know where you stand. your cholesterol ಆಗಲಿ, your inflammatory markers ಆಗಲಿ ಆಗುತ್ತೆ.
ಸರ್ ಇಲ್ಲ, ಕೊಲೆಸ್ಟ್ರಾಲ್ ಎಲ್ಲ ಕಮ್ಮಿ ಆಗಿದೆ. 283 ಏನೋ ಇತ್ತು, 230 ಆಗಿದೆ, ಎಲ್ಲ ಫುಲ್ ಕಮ್ಮಿ ಆಗಿದೆ.
Excellent, Ramor. So don't worry. This has been, I'm not saying it because of my experience. Scientifically it has proven to improve every disease or every organ problem ಮೇಲೆ ಕಮ್ಮಿ ಆಗುತ್ತೆ. ಯಾಕಂದ್ರೆ the body can reverse all these problems that these diabetes or excess of sugar or carbs has caused, provided you don't keep insulting it morning, noon and night. ಮೊದಲು ನಾವೇನ್ ಮಾಡ್ತಿದ್ವಿ, ಬೆಳಗ್ಗೆ ಮಧ್ಯಾಹ್ನ ರಾತ್ರಿ ಊಟಕ್ಕೆ we used to take so much of sugar it couldn't handle. So ಇವಾಗ ತುಂಬಾ ಕಮ್ಮಿ ಮಾಡ್ಬಿಟ್ಟು sudden change ಅಂತ ಹೇಳಿದ್ರೆ body doesn't so easily accept things. ಬಾಡಿ ಲೈಕ್ ಸ್ಟೇಟಸ್ ಕೋ. ತುಂಬಾ ನಿಮ್ಗೂ ಒಂಚೂರು ಡಿಸ್ಟರ್ಬೆನ್ಸ್ ಆಗುತ್ತೆ, ಇದು ಒಂದೊಂಚೂರು ಆಚೆ ಆಗುತ್ತೆ. ಸ್ಟೆಬಿಲೈಸ್ ಆಗಕ್ಕೆ ಸ್ವಲ್ಪ ಟೈಮ್ ಕೊಡಿ, ಒಂದು 6 months ಸ್ಟೆಬಿಲೈಸ್ ಆಗ್ತದೆ.
Okay sir.
Thank you Ramu.
Thank you madam.
Next ಸುರೇಶ್ ವಿಶ್ವನಾಥ್ ಅಂತ ಕೇಳ್ತಾ ಇದ್ದಾರೆ, how can blood sugar affect the vision of a person?
Yeah, see now basically we are eye people, so we know that how badly it affects daily. ಏನಿಲ್ಲ ಅಂದ್ರೂ 100 ರಿಂದ 150 ಪೇಷಂಟ್ಸ್ ಡಯಾಬಿಟಿಸ್ ಒಂದು 5-10-15 ವರ್ಷದಿಂದ ಇರೋರು ಆವಾಗಲೇ ಅವ್ರ ಕಣ್ಣು ಎಫೆಕ್ಟ್ ಆಗಿರುತ್ತೆ. ನಮಗೆ ಕಾಮನೆಸ್ಟ್ ಆಪರೇಷನ್ ನಾವು ಮಾಡೋದು ಏನಂತ ಹೇಳಿದ್ರೆ, ವಾಟ್ ವಿ ಡೂ ಇಟ್ಸ್ ಕ್ಯಾಟ್ರಾಕ್ಟ್ ಸರ್ಜರಿ. ದಟ್ಸ್ ಅ ಬ್ಲೆಸ್ಸಿಂಗ್ ಬೋತ್ ಫಾರ್ ದ ಪೇಷಂಟ್ ಆಸ್ ವೆಲ್ ಆಸ್ ಅ ಡಾಕ್ಟರ್. ಇಟ್ ಇಸ್ ಜಸ್ಟ್ ಫಿಕ್ಸ್ ಅಂಡ್ ಫಾರ್ಗೆಟ್. ಎವ್ರಿಬಡಿ ಇಸ್ ಹ್ಯಾಪಿ, patient is happy, doctor is happy, fine, because you can reverse whatever they have lost and everybody is a happy ending. But whereas diabetes is just, when it affects the eye, it is the opposite. Actually, when it affects the eye is so sensitive that it's obvious. You don't see well, so you run to the doctor. It might have already affected your brain, your heart, your kidney, every organ. It would have affected in the same manner. But since you don't feel it or you don't realize it, you don't go to that concerned doctor. But eye you rush because you can't see. ಸೊ ಅದಕ್ಕೆ ಬರ್ತಾರೆ ರೆಟಿನೋಪತಿ ಅಂತ ಹೇಳ್ತೀವಿ ನಾವು. ಈ ಚಿಕ್ಕ ವೆಸಲ್ಸ್ ಇಂದ ರೆಟಿನಾ ಎಫೆಕ್ಟ್ ಆಗ್ತದೆ. ಫಸ್ಟ್ ಸ್ಮಾಲ್ ಬ್ಲೀಡಿಂಗ್ ಇರ್ತದೆ, ಆಮೇಲೆ ಅಲ್ಲಿ ವೀಕ್ ವೆಸಲ್ಸ್ ಗ್ರೋ ಆಗ್ತದೆ. ರೆಟಿನಾಗೆ ಸಫಿಷಿಯಂಟ್ ನ್ಯೂಟ್ರಿಷನ್ ಸಿಗೋದಿಲ್ಲ. ದೇ ಡೋಂಟ್ ಗೆಟ್ ಸಫಿಷಿಯಂಟ್ nutrition because the blood supply is bad. So it keeps sometimes bleeding massively into the eyes. Initially we start with lasers. Sometimes there is swelling in the back of the eye where the vision again reduces. We need to give them injections, but we don't know the end point. We keep giving 1, 2 monthly and 3, 4. And patients ask us, sir, Where do I stop? How many injections? We have no answers because we are giving just symptomatic treatment. If you can get the diabetes out of your system, that would be the best. I'm not saying you should not follow the instructions what the doctors are giving you to avoid the lasers or avoid the injections. But along with that, if you can also get your diabetes out of your system, you're removing the root cause, and not only your eyes, your brains, your heart, your kidneys, everything slowly will limp back to normalcy. Yes, ma'am.
So, sir, ಹೇಳಿದ ಪ್ರಕಾರ ಡಯಾಬಿಟೀಸ್ ಬೇಸಿಕ್ಲಿ ಇಸ್ ಅ ಮೈಕ್ರೋ ಆಂಜಿಯೋಪತಿ. ಅಂದ್ರೆ ಚಿಕ್ಕ ರಕ್ತನಾಳಗಳು ಏನಿದೆ, ಎಸ್ಪೆಷಲಿ ರೆಟಿನಾಲ್ ಎಫೆಕ್ಟ್ ಆಗುತ್ತೆ. ಅದರಿಂದ ಇದರ್ ಬ್ಲೀಡಿಂಗ್ ಆಗ್ಬೋದು, ವಿಚ್ ಇಸ್ ವಿಲ್ ರಿಕ್ವೈರ್ ಲೇಸರ್ ಆರ್ ಸರ್ಜರಿ. ಸಮಟೈಮ್ಸ್ ನರನು ಕಟ್ ಆಗ್ಬೋದು, ಅಥವಾ ಸೆಂಟರ್ ನರದಲ್ಲಿ ಊತ ಆಗ್ಬೋದು. ಊತ ಬಂದ್ರೆ ರೆಟಿನಲ್ಲಿ ಅದಕ್ಕೆ ರೆಟಿನಾ ಸ್ವೆಲ್ಲಿಂಗ್ ಬಂತು ಅಥವಾ ಎಡಿಮಾ ಬಂತು ಅಂದ್ರೆ ಅದಕ್ಕೆ ಮತ್ತೆ ರಿಪೀಟೆಡ್ ಇಂಜೆಕ್ಷನ್ಸ್ ಬೇಕಾಗುತ್ತೆ. ಸೊ ಡಾಕ್ಟರ್ ಶೆಟ್ಟಿ ಹೇಳೋ ಪ್ರಕಾರ ನಾವು ಶುಗರ್ ಕಮ್ಮಿ ಇಟ್ಕೊಂಡಷ್ಟು, ರಿವರ್ಸ್ ಅಟೆಂಪ್ಟ್ ಮಾಡಿದಷ್ಟು ಈ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಏನಾಗುತ್ತೆ ವಿತ್ ಅನ್ಕಂಟ್ರೋಲ್ ಡಯಾಬಿಟೀಸ್ ಡೆಫಿನೆಟ್ಲಿ ರೆಡ್ಯೂಸ್ ಆಗುತ್ತೆ. ನೆಕ್ಸ್ಟ್ ವಿ ಹ್ಯಾವ್ ಮಿಸ್ಟರ್ ಸೂರ್ಯ ಪ್ರಕಾಶ್. ಜಸ್ಟ್ ಕೀಪ್ ಯೋರ್ ಕ್ವೆಶ್ಚನ್ಸ್ ಅ ಲಿಟಲ್ ಬ್ರೀಫ್ ಬಿಕಾಸ್ ತುಂಬಾ ಜನ ಇದ್ದಾರೆ ಕ್ವೆಶ್ಚನ್ಸ್, ಆಲ್ಮೋಸ್ಟ್ 20-30 ಇದೆ. So, Mr. Surya Prakash, you can please ask your question now.
So, thank you. Sir, are you hearing me?
Yes, Surya Prakash. Please.
Yes, sir. I am Professor Surya Prakash. And see, I am diabetic since 20 years, or more than 20 years.
Yes.
As a month, one big problem, my sugar creatine level was 0.9 till last 6 months. My diabetes was also under control. And I was on tablets, usually diamicrano or metformin. What happened was, suddenly last 3 months back, and both myself and my wife got into COVID a year back. I don't know, I'm really trying to correlate as a researcher whether it is because of that. Yes. Suddenly last 3 months, we stopped responding to any tablet. Yes. Whatever I literally eat, suddenly there is going to be a shoot up of sugar. It is going to spike like anything. Yes. So I consulted the endocrinologist and Dr. P.V. Sunananda from this day. He is coming to our institute, IISc, as a consultant. He gave some tablets, diamicron and linagliptin, voglitard, and all those things. But in spite of all those things, it is not having much effect. It is really shooting up like anything. And my sugar, serum creatinine has gone to 1.48 from 0.8 or 0.9. in a span of, let us say, about 3 to 4 months. And similarly, what is happening to my HbA1c, it used to be around 6 or 7. Now it went to 9.2. On last about a month or two, it came back to 8. Now still I am on tablets only, no insulin. But I don't understand why it is shooting up, spiking like this. Whatever I take, even a little bit of rice, suddenly it will go to 200, 250. Please advise me, sir. I am following you all the time, all your lectures, everything. I'm your fan. But I still am not able to understand. Kindly advise me, sir.
Sir, this, as you don't understand, we also don't understand this COVID. COVID is a very, very, something new. We have not seen it before. So we have not really researched. We think, it just causes fever and lung problem and all that. It can affect any and every single organ in the body. I have noticed that. What story you have told me, I've heard lots of people saying this. Lots of people who have already reversed the diabetes following this diet have suddenly said, sir, my sugar is again shot up. I'm with the same diet, low carb diet, not taking any, carbs or very low carbs and no sugar. Sugar is shot up again. For 2-3 months, this happens. This is the effect of COVID, sir. We really don't know. It might have affected your kidneys. It might have affected your pancreas. It could have affected your every other organ. So let's hope and pray that it's a temporary phenomena. With time, your body would be able to regain whatever it has been affected by COVID. And I'm sure you'll get back to your normal stages again. But my earnest, you have heard me. It's more important to follow what I said, because this is the latest what science says. I wanted to, make you're a PhD professor. Do your own research about this low carb diet and all the studies that have been done and what the amazing results you get. See, the whole problem is sometimes it looks very silly. See, if your basin is overflowing and you're constantly mopping the floor, even a child will tell you, why don't you shut the tap? That's what we are trying to tell you. Just don't eat the sugars that you can't tolerate, sugars and carbohydrates. But luckily, we have got alternative ways of running the body. The body has alternative energy, and which is supposed to be even better energy than carbs and glucose. And then you could get rid of your sugar intolerance and these tablets, because just keeping the sugar under control with all these tablets and injections, ಅದಕ್ಕೆ ನಾನು ಹೇಳ್ತೇನೆ ಕನ್ನಡದಲ್ಲಿ ಬೂದಿ ಮುಚ್ಚಿದ ಕೆಂಡ ಅಂತ. It is still burning you from within, because we have seen that people who are under fairly good control for 10-15 years having their eyes getting affected. And you know that, as years go by, your medication keeps on increasing because it is unable to control it, because you are eating directly or indirectly these carbohydrates morning, noon and night, and then you need tablets on the other side. So that's not a good idea. So kindly take up this low carb diet, and let's hope within some time your creatinine will go back to normal and your sugar will come under control. Prakash. Yes, ma'am.
Yes, so next question is a couple of questions on diet. So I think we can take them one by one. So briefly, we'll just answer because we have a lot of questions and people wanting to talk. First question is ragi ball good for reversing diabetes?
No, I'm sorry. All grains ultimately end up in the blood as glucose. Grains andre your rice, wheat, ragi, millet, corn, roti, ಎಲ್ಲ ultimately ನಾವು ಇಲ್ಲಿ ತಿಂದು ಸ್ವಲ್ಪ ಹೊತ್ತಿಗೆ ವೈಟ್ ತಗೊಂಡ್ರೆ, ವೈಟ್ ರೈಸ್ ಅಂಡ್ ರಿಫೈನ್ಡ್ ಇದು ಗ್ರೇನ್ಸ್ ತಗೊಂಡ್ರೆ ಭಾರಿ ಬೇಗ ನಮ್ಮ ಬ್ಲಡ್ ಹೋಗುತ್ತೆ. ಅದಕ್ಕೆ ಬ್ರೌನ್ ತಗೊಳ್ಳಿ ಅಂತಾರೆ, ಕೊಂಚ ಲೇಟಾಗಿ ಹೋಗುತ್ತೆ, ಬಟ್ ಹೋಗೇ ಹೋಗುತ್ತೆ. And I don't have, my body can't tolerate it, it can't digest it, it can't metabolize it. So there is no point. So if you wear what I wear is what's called a constant glucose monitor. ಏನೇ ತಿಂದ್ರು ಅರ್ಧ ಮುಕ್ಕಾಲು ಗಂಟೆಯಲ್ಲಿ ನನ್ನ ಶುಗರ್ ನಾನು ಟೆಸ್ಟ್ ಮಾಡ್ಬೋದು ಈ ಮಾನಿಟರ್ ಅಲ್ಲಿ, and ಹೇಗೆ all these things increase my sugar ಅಂತ ಗೊತ್ತಾಗುತ್ತೆ. So kindly, if you want to reverse your diabetes, and you need to get away from all grains, sir, all grains without exception. ಕೆಲವರು ಅಯ್ಯೋ ಶುಗರ್ ಬೇಡದಿದ್ರೆ ಜಾಗ್ರಿ ತಗೊಳ್ಳ ಸರ್ ಅಂದ್ರೆ, ನೋ, ಜಾಗ್ರಿ, ಹನಿ, ಶುಗರ್ is sugar. So kindly stay away from it. It's a behavioral problem. You can get delicious, tasteful food made out of healthy fats. Fats are more satiating. They're more delicious than carbohydrate. Actually, 50 to 60 years back, we ate more of that than all these sugars, because we were brainwashed to say that fat causes fat, that causes heart attack. So go low fat, go no fat. We gave up one thing. When you give up one thing, you take up the other, na? So we took up eating more sugars, and then the whole world got sick. That's a medical mistake. That's our problem, actually. So now we have realized that with the best of equipment, with all the modern medications and all that, why is the world getting sicker and sicker by the day? That means there is something wrong in what we are saying. We need to turn the whole thing upside down, go back to how our ancestors eat, natural food. Don't eat too much of processed food. Don't outsource your kitchen, as I said earlier. Eat natural fats, like, not refined ones. You eat cold pressed coconut oil, or you could have cold pressed groundnut oil, or butter and ghee. But all this provided you have no sugars and you reduce your carbs. Only carbs that you can eat is green carbs. So I keep telling, eat one big bowl of fatty salad, not raw boiled. Use butter, cheese, whatever you want. Make it as tasty as possible. One big bowl of non-starchy vegetables and leafy greens. One bowl you'll eat before breakfast, one bowl you'll eat before lunch, one bowl you'll eat before dinner. That itself will fill your stomach. You'll have hardly any place to eat anything more. That itself will give you the best results. That's what I keep telling my people. So just follow this. Yeah.
I think that answers questions of Mr. Girish Balur, also Mr. Kunjatur Chandrahas. They all had questions as to what is the food that you can have. Even Mr. Suresh Vishnathan had asked. He also wants to know whether it is okay to have fruits, and which kind of fruits should one have.
Yeah. So that's another thing. Of course, you're hale and healthy and young and metabolic quite well. Some amount of fruits you can have, all these fruits that we're talking about. But otherwise, if you're a diabetic or a pre-diabetic and you are trying to reverse it, definitely not. Because our fruits, mangoes, even apple, they all have excess of sugars, because they've all been genetically modified. These fruits, if you have seen them 50, 60, 70 years back, they would have been 1/3 their size and 1/3 the sweetness. They have been genetically modified because, they want to sell more, they want people to eat more of it. I mean, it's a business strategy. But then we got more fruits, but it made us more sick. So if you're a diabetic or a pre-diabetic, or you want to lose weight, definitely keep off all these fruits. Exceptions are that you could eat a little of berries. It has got the least amount of sugar in that. But the best fruit is what's called avocado. It is not sweet. It's called butter fruit. Excellent fruit. Earlier we used to say an apple a day keeps the doctor away. Now it is an avocado a day keeps the doctor away. Excellent fruit. It's satiating. It has got a lot of micronutrients that you can eat. Rest is better you avoid. But most important thing is never ever drink your fruit. That is the best thing I can tell you today. That is, we think, healthy breakfast is you have oats, that's again cereals, very sad. You have skim milk, that again has got a lot of carbohydrates. Then you have bread and jam filled with carbohydrates, and then one big glass of orange juice. We think that's a very, very healthy way. It is absolutely not. Every time, see, if you have to eat a fruit, what I've been saying is avoid, you'll eat maybe one fruit. But when you make it into juice, you make 3, 4, or 5 of them into a glass of fruit juice. There, and more than that, the goodness in that fruit, the fiber and other things, you just throw it away, and you are literally drinking a sugar syrup, a glass of sugar syrup. It is as bad as drinking a Coca-Cola or a cola, or actually even like a glass of whiskey in the morning. Because I must tell you why I call it whiskey. Like alcohol, fructose, which is there in fruits, can only be metabolized by the liver. And why children are getting fatty liver is that they're eating so much of this sugar has got 50% fructose, and these fruits have got lots of fructose. So you keep drinking this, it overwhelms the liver becomes fatty, and that is the starting stage for insulin resistance and diabetes. So never ever drink your fruit, please. Yes.
One more question, I think that's pertinent to diet. Soumya wants to ask is, can we have eggs? Got to know that residue of antibiotics are found in eggs, which can affect our immune system. Yes,
eggs as a whole is a fantastic food. Yeah. But whatever I'm saying now, I do not want to really make it too restrictive. You must go as natural as possible, as organic as possible. So if you really want to have, antibiotic-free eggs, and we have to what is called free-range chicken. That means chicken like how we had in our villages during our younger days. We grow our own chicken. They should run around, eat, and this thing. They are the best chicken. These farmed ones who are kept in farms and where they lay eggs, they are given antibiotics. A hen or any animal is as healthy as what we feed them. When they are fed with all these grains that are infested with pesticides and these antibiotics, definitely they are not very good. So, but if I say eat only this organic food, get only free-range chicken, eat only pasture-raised milk products, then it becomes very restrictive. At least let's get the first step right. But definitely there is no doubt that egg is a fantastic, nature's best packaged food. I take minimum 3 eggs a day with the yellow. Every time I tell people that, eat a lot of eggs, they say, what do I do with the yellow? I said, yellow is more important than the white. So eat with yellow, eat with lots of vegetables, make that your breakfast. Otherwise, if you go to the typical Indian breakfast, 100% sugars you are having. So egg is definitely fantastic. You can eat easily 4 to 5 eggs a day if you want, no harm. And if you can get organic eggs from free-range birds, which is a little difficult, that will be the next step. At least let's cut out the bad things. Yes.
So another question is, what type of cheese as can a vegetarian have? Because I think cheese also is high in protein.
I think plenty of, you can use whatever cheese you like. That's absolutely no problem. I mean, it has got very little carbs. Whichever cheese you like, you add it the way you want. There is no harm. It has a lot of proteins. It has got fats, satiating, and it's good. There is no doubt on that. There is no restriction on cheese and butter. But again, get it as natural as possible, as organic as possible. That will be the next step. You go, then you say, no, I'm not getting natural organic eggs. I'm not getting organic chickens. So I eat idli dosa. Please, That's still worse.
So one other question I think sir has already answered. What is the best diabetic food for a vegetarian? Is anything other than meat, which is low in carbs. You can have paneer if you're a vegetarian. If you can manage to eat egg, nothing like it. And you get a lot of, what about the soya chunks and also? They're also high in protein, low in carbs.
No problem. You can eat all of them. Yeah. It's a little more difficult for vegetarians when compared to non-vegetarians, but it's not impossible. You can have, as
what about pulses, sir? Pulses are okay?
Pulses to some extent, because you need to get your proteins. You don't make that as a meal as such. See, what we're trying to say is, see, ಹೇಳ್ತಾರಲ್ಲ, ಅನ್ನನ ಪಲ್ಯ ತರ ತಿನ್ನಿ, ಪಲ್ಯನ ಅನ್ನ ತರ ತಿನ್ನಿ. That is the way we must go now. If you are eating, say, so much of rice, ಪಲ್ಯ ಎಷ್ಟು ಚಿಕ್ಕದಾಗಿರುತ್ತಲ್ಲ, ನಾನು ರೈಸ್ ಬಿಟ್ಟೇ ಬಿಡಿ ಅಂತ ಹೇಳ್ತೀನಿ. ಇನ್ನು ನಾರ್ಮಲ್ ಪರ್ಸನ್ who's not a diabetic also, ರೈಸ್ ನ ಪಲ್ಯ ತರ ತಿನ್ನಿ, ಪಲ್ಯನ ರೈಸ್ ತರ ತಿನ್ನಿ. That's how we need to do things. So if you follow that, I think vegetarians also can follow a low carb diet. Proteins ಗೆ pulses ಸ್ವಲ್ಪ ಬೇಕಾಗುತ್ತೆ in moderation. You can't make it a meal as such.
ಆಮೇಲೆ ಇದು ವಾಣಿಶ್ರೀ ಹೇಳ್ತಾ ಇದ್ದಾರೆ, if no rice, ragi, wheat, millet, then what should we eat?
So much options are there. I told you, see, the whole problem is, of course, you get in touch with us. We, one of our videos and all that, all options are there. You avoid potatoes ಒಂದು ಬಿಟ್ಟು ಬೇರೆ. ಫಸ್ಟ್ ನಾನು ಹೇಳಿದ್ನಲ್ಲ, ವೆಜಿಟೇಬಲ್ಸ್ ನ you make it the major portion in every meal. First you have that and have it with a lot of ghee, butter, ಒಗ್ಗರಣೆ ಕೊಡಿ. Make it very, very tasty. After that you can use plenty of coconut milk. vegetables ಚೆನ್ನಾಗಿ ಮಾಡಬಹುದು. ಚಪಾತಿನ ಕೂಡ, ರೈಸ್ನ ಕೂಡ you can make it out of non grains. ಅದೇ ಕಾಲಿಫ್ಲವರ್ ರೈಸ್ ಇದೆ, ಅದನ್ನ ಬೇಕಾದ್ರೆ ನೀವು ಗೀ ರೈಸು, ಬಿರಿಯಾನಿ, ಕರ್ಡ್ ರೈಸು ತರ ಮಾಡಿಬಿಟ್ಟು ಅದನ್ನ ತಿನ್ಬೋದು. ಕಾಲಿಫ್ಲವರ್ ರೈಸ್ ಇದೆ. You could go to YouTube and find out the recipes. Then you have coconut flour and almond flour from which you can make chapatis. ಅದು ಮಾಡಿಬಿಟ್ಟು ವೆಜಿಟೇಬಲ್ಸ್ ರುಚಿಯಾಗಿ ಬಟರ್ ಪನ್ನೀರು ಅದು ಏನ್ ಮಾಡ್ಕೊಂಡು ಊಟ ರುಚಿಯಾಗಿರ್ಬೇಕು. You must eat till you are full to satiety. It is not we don't want you to count calories. Eat till you are full. Stop, eat when hungry, stop when full, never feel deprived. That's because we are saying that you should adopt it not for just 3 months, 6 months, 1 year. It should become a lifestyle. That's the idea. So it should be sustainable. Yes.
So another question somebody is asking, and I think I can probably answer that question, is diabetic retinopathy reversible? So I think it basically depends on the extent of damage to the retina. We have seen that there is a decrease in the severity scale. We call it as a diabetic retinopathy severity scale, DRSS score antivi. Lower levels of damage iddaga, with a very good systemic control, the severity can actually come down. But when you're looking at very advanced diabetic retinopathy, tumba jana patients ಬಂದು ಕೇಳ್ತಾರೆ, ಇವಾಗ ನಂಗೆ ಶುಗರ್ ಕಂಟ್ರೋಲ್ ಬಂದಿದೆ ಡಾಕ್ಟರ್, ನಾರ್ಮಲ್ ಆಗುತ್ತಾ ರೆಟಿನಾ? ಇಟ್ಸ್ ನಾಟ್ ಪಾಸಿಬಲ್, ಬಿಕಾಸ್ ರೆಟಿನಾ ಇಸ್ ಅ ವೆರಿ ಡೆಲಿಕೇಟ್ ಲೇಯರ್ ಆಫ್ ದ ಐ. ಸೊ ಅದಕ್ಕೆ ಒಂದ್ಸತಿ ಶುಗರ್ ರಿಲೇಟೆಡ್ ಡ್ಯಾಮೇಜ್ ಆಗಿ ಬ್ಲೀಡಿಂಗ್ ಆಗೋಗಿದೆ ಅಥವಾ ನರ ಕಟ್ ಆಗಿದೆ ಅಂದ್ರೆ ಇಟ್ ಕೆನಾಟ್ ಕಮ್ ಬ್ಯಾಕ್ ಟು ನಾರ್ಮಲ್. ಬಟ್ ಆಸ್ ಅ ಡಾಕ್ಟರ್, ಆಸ್ ಅ ಫಿಸಿಷಿಯನ್, ವಿ ಕ್ಯಾನ್ ಹೆಲ್ಪ್ you get good vision or the best possible vision with treatment, but it's not reversible per se. ಅದಂತೂ ನೀವು ಜ್ಞಾಪಕ ಇಟ್ಕೋಬೇಕು. ಜಸ್ಟ್ ಶುಗರ್ ನ ಕಂಟ್ರೋಲ್ ಬಂದ್ಬಿಟ್ರೆ ಇಟ್ಸ್ ನಾಟ್ ದಿ ಓನ್ಲಿ ಥಿಂಗ್. ಎಷ್ಟು ಮಟ್ಟಿಗೆ ಡ್ಯಾಮೇಜ್ ಆಗಿದೆ is also very, very important.
Yes, I agree with you, Chaitra. See, but one thing is, we as doctors, we keep on harping on controlling sugars. Very important. If you don't see, uncontrolled sugar is definitely worse than controlled sugars, but no sugar is definitely the best way out. So what I'm trying to say is that I'm not trying to say that just you change your diet and automatically everything will get reversed. If you need some treatment for the eyes, you please go ahead. Along with the treatment, try to get rid of your sugars. Not control. Get rid of it through diet alone, and then see what happens. Because we are just started studies to show what we want to know how it is going to affect retinopathy. Studies have just started. Nowhere in the world they have done enough number of these studies. We have started at our place now. We are going to see people, early stage of retinopathy, with this low diet. What happens? Do they progress? Do they stabilize, or do they reverse? Let me tell you, in my case, before I started off this low carb diet 1.5 years back, my creatinine is 1.5. That means my nephrologist told me that 50% of your kidney is gone, because one normal kidney is enough to keep you under 1.5. Now that is 1.5. So I was worried. because you know how it is. It is a downhill course. But I took up this to reverse diabetes, and within 3 to 4 months, to my astonishment, my creatinine came down from 1.5 to 1. That means whatever damage this diabetes has caused in the small vessels in my kidneys have been reversed. That means that thing must be happening in my brain, in my eyes, in my heart, in every other organ. So what I'm trying to tell you is, don't just sit back. You need to get your eyes tested. If doctor suggests some treatment, you need to take it. But along with it, just get your diabetes out of your system. So then what happens? You will know what happens. Whether you'll require the same number of amount of laser, same number of injections, or it decreases, or it reverses. We are putting a study now. Maybe after 1 year we'll have the answer for you. But my personal experience is that it can reverse, especially if you're in the early stages. Yes. Yeah.
So one question is from Hostabelaku Trust. They want you to talk about maybe whether this program is possible for those with juvenile diabetes.
Yeah, juvenile diabetes and type 1 diabetes. It's a total different ball game altogether. In that, there is absolutely no insulin. Insulin body manufacture madadilla. So avrige bere vidine illa. Avrige injection of insulin kodlebeku. All right. Whereas type 2 nalli insulin production is there, but because of insulin resistance, the body is not able to use it, and so the sugar goes up. Type 1 juvenile diabetes nalli insulin illidrinda from day 1 they'll need injections. But avrige kuda, if they go on this low carb diet, the amount of injection that is necessary for them will come down. See, now ee kadeinda sugar tinta idre aa kadeinda jaasti injection kodbekagutte. Ee sugar carbohydrates na now kammi tindre injection naturally kammi agutte. And now we have people who are living quite a normal life with even in type 1, provided they take less of carbohydrates and sugars. Yes.
What is the optimal daily sugar intake for a normal person? Quite a few people have asked. I think they want to know probably in terms of a spoon. Yes. Or
the WHO recommended sugar, the added sugar I'm talking about. I'm not talking about the hidden sugar in our grains. I'm talking about the added sugar, the table sugar ಅಂತ ಹೇಳ್ತೀವಲ್ಲ. ಅದೇ ಪ್ರಾಬ್ಲಮ್ ಆಗಿದ್ದು. ಅದರಲ್ಲಿ ನಾನು ಹೇಳಿದ್ನಲ್ಲ 50% ಅದು 50% ಗ್ಲೂಕೋಸ್ ಮತ್ತೆ 50% ಫ್ರಕ್ಟೋಸ್ ಇರೋದು ಅದರಲ್ಲಿ. ಈ ಫ್ರಕ್ಟೋಸ್ is the one which is very, very damaging and causes insulin resistance and diabetes. Anyway, we officially recommended is around 6 teaspoons officially. But it has been found out that each one of us on an average take 24 teaspoons of sugar every day. That amounts to 40 kgs of sugar in a year. And I must tell you, friends, that the 5 liters of blood in our body has total of just 1 teaspoon of sugar it can hold. Blood can hold in a normal person just 1 teaspoon. Anything above that has to be thrown out of the blood. And that's this insulin does. And every time we eat even a single bowl of white rice, it has 10 teaspoons of sugar. That means we have added 10 times more than what the blood can hold. So that we are doing morning, noon, and night. And the body struggles and struggles and struggles, not for 1-2 years, 5, 10, 15 years, to keep your blood sugar down, increasing insulin production and all that. And at the end, it just gives up. And that time you say, oh, I've just become a diabetic. I'm sorry, you have been a diabetic. Our body has been struggling to keep that sugar down for the last 5, 10, 15 years by increasing the amount of insulin production. But when it can't do anymore, when it gives up, then your blood sugar starts creeping up. So when your blood sugar goes from 1 teaspoon to 1.5 teaspoons, you are declared a diabetic. And we keep pumping in 20, 30, 40 teaspoons into our blood. That's how much we are doing. That's why all these modern problems and modern diseases have come. Yes.
Okay. Next question is, and I think we should congratulate Mr. Jayalakshmi. She says, I'm a working woman. I started RDC or reversing diabetes program from 2 months. I have now been able to stop my diabetes tablet, but she wants to know, is there any way that you can make the diet a little bit more comfortable? I think most of their concerns is with the diet related.
Yeah, no, what I see, especially what I advise ladies, and I tell my wife, is that, see, we have to, make the food very delicious. because it's a lifetime change. People must not think, it's a diet. It's not a diet. It's a lifestyle. And it has got to last a lifetime. If you go back to your bad foods, now we have switched over to these good foods. You got rid of your medicine. If you go back to the bad foods, then again, the bad diseases are just waiting in the wings to come back. And then you need to take your tablets again. You can bring in a little with time. I mean, not within a few 2-3 months, maybe after 6 months, 1 year, eat a little more of your grains, and definitely not sugar. Definitely not sugar. Little grains. I know they say it is portion that makes the poison. Reduce the quantity to a great extent. Have a little of this. But I am a little worried. It's like, having given permission is like making a small hole in your boat. Slowly the water starts creeping in and you start sinking again. So you have to be very, very careful when you're trying to, bring back the old diet. Very, very little of it. Gradually keep checking your blood sugars. If you think it's going up again and your doctor saying you need medicine again, go back to your proper diet and the blood sugars will be. Here we are using food as medicine. Either you use food as medicine, or in the long run, medicine will become your food, because we eat so much of tablets, 10, 12, as I was doing maybe 2 years back.
Sir, there's one question. My sister is 34 years old. She weighs 95 kilos. Her reports came and HbA1c is 7.3. And I think she's also on glycomed. They want to know whether her diabetes can be reversed.
Yeah, this is the right time. See, earlier, if you're a diabetic for 1, 2, 3 years, it's very easy actually to reverse it. You just follow this and you see dramatic results. People like me who have been there for 15, 20, 25 years, it's a little more difficult. But a young diabetic, that means who's been a diabetic for 2, 3 years, who's overweight and obese, definitely this will work wonders. That's what I'm trying to tell you. It will work like magic. It is nothing short of a miracle. You follow this, you will soon get rid of your tablet. You will soon get rid of your weight. You will soon get rid of your diabetes. You just try it for yourself. And once you see success, once it has helped you, spread the good word. Only problem I want to warn you is that a diabetic who's on tablets, especially stronger tablets like sulfonylureas and insulin injections, because diet is so powerful, it is more powerful than any of your drugs, your sugar levels will drop dramatically and you need to immediately reduce your drugs. Otherwise, you may go hypoglycemic, which is even more dangerous than high sugars. So we don't want anyone to get into that stage. That's the only place where you require some medical advice. Otherwise, anybody can do it.
One question, I think this is very important. Mr. Madhav is asking, I am now 47. My father has diabetes. Is it hereditary, sir?
Yes, that's what I keep telling. If there is a family history of diabetes, there's no doubt the chances of you getting diabetes is very high. But not that you must get it. So most of the time I keep hearing, sir, I got diabetes. When did you get? When I was 45. No, sir, my father had, my mother had. So we blame our parents. So what I try to say is that genes only load the gun. It is your eating habits, a lifestyle that pulls the trigger. So it's the environment that can make a big difference. Environment and how you eat, your lifestyle can switch on or switch off this gene. That is now being studied. It's called epigenetics, how genes can be switched on and switched off depending on your lifestyle. So lifestyle is very important. And in case you have a family history, you need to be all the more careful. So right away, just give up your sugars and go very low on your grains and you'll be safe, I feel.
I have been taking, again, diet-based questions. I have been taking Rajpuri rice for the last 1 month. Is it better than white rice? No. I think they want to know about the different type of rice. And
rice is right. Rice. White rice is definitely bad. It's white trash, we call it. White rice, white sugar, white bread. But even brown is equally bad. Brown rice, brown wheat, whole bread, they say. Because ultimately, it goes into the body as glucose. And so glucose load is the same. And when you're intolerant, when you can't handle so much of glucose, there's no point in putting more glucose into the body directly or indirectly or delayed. It is going to raise your sugars. Your body can't handle it. So rice in any form does not really help.
Quite a few questions on whether they can have this protein powder.
See,
after exercising, whether it can raise their blood sugars post-exercise. Many of them are asking that question.
See, better to get everything naturally. See, we have to go back to nature. We are having too much of artificial foods. That's the processed foods and powders and all. I don't think it is necessary. You get your protein from natural sources. If you are non-vegetarian, it's very easy. From egg, meat, fish, all this you can get good proteins. If you're vegetarian, you get it from all your, as you say, pulses and paneer and tofu and soya. So you get natural sources. I think you should try and avoid these unnatural processed foods as far as possible.
Few other questions are, does the lack of sleep make us more susceptible to diabetes?
Yes. Good sleep, reduction in stress, all help. And exercise. These are also other pillars, but you could never outrun a bad diet. So some people say, okay, I eat this, but I'll exercise for 2-3 hours. It's okay. It's not okay. You have seen people who are fit on the outside, drop dead, as I told you, on the stage or, while working. That's very sad. So if you eat the right food, medicine is not necessary. If you eat the wrong food, medicine will not make a difference. So food is very, very important, but definitely good amount of sleep and stress reduction and exercise also important.
Yeah, next question is, I have been following the RDC diet in 6 months and finding sugar levels in the range of 108 to 120. Since 1 week, the sugar levels are showing 137 to 160, though I'm following same diet. May I know the reason for this fluctuation? Why is it changing from time to time? Also, HbA1c has come down from 10 to 6, I think, which is very good. But why sudden increase in the sugar levels when I'm following the same diet?
Yeah. See, the whole problem is when you test, by this pricking method, you're just testing, just that moment what your sugar is. If you test my sugar now, because I'm addressing this audience and all that, it will be 180, 190. That means body also makes sugars. Body prepares me for any eventuality. When I need more energy, it will produce its own sugars. I have no control over that. So don't go by blood tests alone. The average 3 months average is a good indicator, HbA1c. And since your 3 months average has come down, that's a great indication that you should continue with this. A little variation here, there, depending on the time of day. Sometimes when I get up in the morning, my sugar is 140. But I can know what's my sugar at midnight. At 1 o'clock, it would have been 110. I have not eaten anything in the morning. That's called the dawn effect. The body is preparing you for the day. I usually get up and do some exercises. So it's already, giving me energy. It feels that I require energy. The liver will manufacture some amount of sugar and put it into the blood, and my blood sugar goes up. We need not worry about the internal variation that we don't have really too much control. But what we put into our mouth, we have control over. After eating 1 or 2 hours, 1 hour after eating, if sugar, spikes, then we need to get worried.
One other question they have is, I think a couple of questions I can also take. Any age people having Kellogg's cornflakes, is it good for people with BP? Actually, I don't think there's any connection with blood pressure eating Kellogg's cornflakes, but these are products which are claimed to be very healthy, but they do have very, very high levels of carbohydrates and sugars. You should just read the package. They say that it's low in fat, but I think we are more concerned about carbohydrates, as Dr. Shetty has been telling us. How much water should we consume per day? I think the water also depends on a lot on your renal disease. What is the function? You have to be very careful because there can be an overload. So I think a good number that they say 6 glasses of water or a little more, but don't consume so much that it creates a problem. One more question is, I am told that cabbage cauliflower is not good for people with thyroid issues. I've also heard about cauliflower rice, but I've been keeping away from it due to the restrictions. Please advise. Sir, you want to take this?
Yeah. No. If your doctor has advised you to go low on that, 1 or 2 vegetables, you got hundreds of other vegetables, excepting starchy vegetables. That is, especially potatoes, and all those below ground vegetables also have a little more, but then you can have in moderation. but definitely not potatoes. And if they restrict 1 or 2 vegetables, so be it. But ultimately, let me tell you, friends, that they are all one and the same disease. Once you get down, your insulin resistance comes down, your blood sugars comes down, body starts healing, all these problems will disappear. That has been my experience. And that has been the experience of people who are following this. I've been following it for only just about a year and a half. I have heard people who have followed it for 5, 10, 15 years. It's followed all around the world now. It's catching up, but individual practitioners and people who are talking about it. But I want more and more people to talk about it. I want more and more people to experience it. And just don't go on the face value of what I said. You can do your own research. Now they say, you get information at the click of a button. Do your own research, do your own due diligence. Once convinced, try it on yourself or some of your near and dear ones and see the results. And the results are so easy. It is all measurable. Your weight can be measured. Your waist can be measured. Your BP can be measured at home. Your blood sugar can be measured at home. Even you can get your cholesterol thing measured. You just measure these 5 parameters 4 weeks after following this kind of a diet, and you see the results for yourself. Only when you feel that it works so well, then you could tell friends and neighbors who are also suffering. Only thing is, be careful. If they're on medicines, that needs to be reduced. Or if you feel it's not working, just throw it out of the window. That's my request.
Second. So many people are asking whether it is only glucose that's dangerous or even sucrose and fructose. I think they're all units of glucose itself. Yeah. So they're all, the building block is all glucose. So I think they're all equally bad.
Not equally bad. Fructose is worse than glucose. Fructose, as I said, can be metabolized only by the liver. Glucose can be metabolized by every cell in the body. So as soon as you take fructose until one, it's in fruits. That's why we say go slow on that and never drink your fruit. Next, even in that sugar that we add, the white sugar that is added to everything, every product, white, that has 50% fructose. No wonder children are getting fatty liver. That goes straight to the liver. Liver gets overwhelmed, liver gets fatty, liver becomes sick, and then that causes insulin resistance. That causes weight gain, and the whole story goes on and on. So fructose is even more dangerous than glucose. Yes.
So I think many are now asking us on how to go about the diet. So we will share that eventually on our website. It's impossible for us to give, a dietary advice on this platform. So we will be putting up recipes. We'll be sharing the entire book for the how you can, prepare these dishes as well, simple dishes. But it's going to be difficult for us to, individually share it because these diets are based on your food habits, whether you're vegetarian, non-vegetarian. So that's going to be a little difficult. Dr. Sudha Singh is asking advice about traditional foods such as idli, dosa, and uttapam. I think sir has spoken about it already. You can use coconut flour, and you can use chutney in abundance. You can use your sambar, but reduce the rice-based dishes like idli, dosa. But you can make it with alternative sources to make the same.
What people tell me, Chaitra, is that our parents, grandparents, and for generations they've been eating that and nothing has happened. I'm sorry to say that their lifestyle, the kind of food they ate, completely different from what we are eating now. They grew their own food. It was organic. There were no pesticides, and they were on the field throughout the day. They used to burn what they ate, and most important is they never ate so much of sugar. That is the crux. We have sugar for breakfast and snacks in between 3 times, then lunch, then every meal. There's a birthday, somebody's birthday in the office every day. We eat cake, then celebrations every day. This never happened when during our ancestors. They were eating definitely grains, no doubt, but the maximum, and they used to burn those calories because they were on the field. They were not so much tensed. So the quality has come down now multifold. The stress level has come up multifold. No wonder we are in this position. No wonder we are seeing all this. Because although they ate it, but they were a different type in their lifestyle. See our lifestyle. We eat, and sugar all the time. And our stress levels are very high. We don't do so much of, we are not, they're mostly, they used to, even if he was an owner or had a lot of fields, he used to be in the field itself. He used to move around from morning to evening. But we never, we are seated here. We don't burn our calories. We only store what we eat. So people say you are what you eat. No, you are what you store from what you eat. So when you eat a very high carbohydrate diet, people may say, how is that, fat doesn't make you fat? It's very simple. When you eat carbohydrates in excess, because of the very high levels of insulin that it creates, insulin is a fat storing hormone. Whatever you eat, immediately it will ask the body to store it as fat. So liver will convert the carbohydrate into fat, put it into your blood or put it into all the cells and store it up. So because the insulin is constantly high, it not only stores the fat, but it locks it away. And when you are hungry, when you need it, you can't get it back. So insulin is like a miser. When a miser earns money, he'll run to the bank and put it in the bank, not just bank, he'll put it in a fixed deposit so that his wife will not force him to open it again. So that's exactly what insulin. So you feel hungry again, you want to eat again. And then half you burn for yourself, the other half again is stored and locked away. This is how we become fatter and fatter and fatter. When you reduce the carbohydrate, the insulin level comes down. So the most important factor here in diabetes is not your glucose or your carbs, but it's your insulin. And the nutrient that stimulates insulin is carbohydrates and sugars. So when you reduce this, insulin comes down, then these fats get unlocked and you start burning fat. You burn the fat that you eat, you burn the fat that is stored. So eat fat to burn fat. It's like setting a thief to catch a thief. Yes.
Okay. Sometimes after evening walk for 45 minutes, I get a sugar level come down drastically. It becomes unbearable and I feel like going immediately taking sugar. However, I don't take sugar, but the meal quickly. So I think they want to know when there's a rapid reduction of sugars post-exercise, how to manage that.
These rapid reductions in sugar happens only if you are on some tablet or injection. Body by itself will not reduce your sugars below normal levels at all. It is these tablets and injections that force it down. Especially when you exercise, muscles start pulling out sugar and then the blood sugar drops. Actually, it's a good thing. You need not go and have an early dinner or a snack. Best is reduce your tablets or injections. That's the best way. That's that means that you need to reduce your this thing. Don't go eating. Then it becomes a vicious cycle again. Reduce your tablets.
What about next question is, what about adding Horlicks Light, Ensure Diabetic Powder, Diaplan, and D protein? Is it safe?
All these processed foods are not very safe. That's what I can tell you. Unless it is very clearly and said that it is, extremely low carbohydrate, you go through it. And because they have added some micronutrients like vitamins and minerals, that doesn't make it safe. So you have to be very, very careful. Best is go natural, go organic, go natural.
I'm using the Sugar Smart Atta. I think so. Diet-based questions are a little difficult for us to answer here individually. Yes. Also, many of you all are asking for recipes and diets. We will be putting it up on our website and our social media very soon. We're in the process of making a recipe booklet just for patients who are going for the reversing diabetes program. So we will be sharing that very soon. One question is, practicing yoga going to help in reversing diabetes? So,
no, practicing yoga, doing regular exercise is definitely very good and is needed. But that is not going to reverse. As I told you earlier, you could never outrun a bad diet. If your diet is bad, whatever you do, including your medications, will not help you. Because even you have noticed that medications need to be increased every time you visit your doctor. That means it's not helping. Diet is bad. There is no way you could do anything to reverse your diabetes. But you have the right diet, you do the exercises, you do yoga, you do meditation. They definitely help.
So one question I think is very pertinent is many people who are on this program need to travel on work to other cities. Yes. How does one manage diets and this sticking to the program when they're traveling?
It's not impossible. It's a little difficult though, I understand, because you don't get these kind of foods everywhere. But as I say in English, if you're out to beat a dog, you'll surely find a stick. You know the general outline, what is good and what is bad, what's to be avoided and what's not to be taken. So fine. Say you go for a wedding. you have, complete vegetarian meal there. What I do is I ask him to put more of the vegetables. As I said earlier, eat vegetables like rice. And I don't take rice. I don't take all the sweets. Only the vegetable portion I eat there. Or if you go for a buffet, you'll have a lot of vegetables there. You take that. Then avoid the naan and roti that's supplied there. You see, we should get out of that mental block that eating rice itself just is a meal. Eating naan is only completes a meal. No, eat good amount of vegetables with good oils, olive oil or whatever, and then have a lot of other vegetables you can fill your stomach with, because it also has some fats, it has proteins. So only thing is you have to avoid all these rotis and naans and rice. If there is biryani, eat the piece, not the rice. If you're a non-vegetarian, it's very simple. You can go and just eat a few pieces. I'm not saying that eat only meat all the time. When you go out, if you don't find anything else, do that. Better still, if you know that you're going out for dinner and you're worried you're not getting have your meal a little early and go. Just socialize, eat some vegetables to keep company, and there you are. You can. It's not impossible. Yes.
Okay. Many questions are regarding family history, regarding what kind of how can I have tea, coffee. I think we've already spoken about these particular questions, so we'll not be going over them again. I think one question that's probably pertinent is again whether cashews, almonds, walnuts, and pistachios, figs, and cranberries, are these allowed?
Yes, I want to make things very clear. Nuts are good, but not dried fruits. So we always tend to mix the two. Like fruits and vegetables, we think they're great. As I told you, vegetables are great, fruits are not so great. Here also, nuts and dry fruits, they go hand in hand. Nuts are great, definitely not dried fruits. Dry fruits are sugar bombs. They are concentrated. You must avoid this. Dry fruits you could have as snack. So when I want to snack a little in the afternoon with my tea, milk and tea you could take. There's no problem. I am not restricted. So we don't want to be too restrictive also. It's not necessary. But have nuts. But go slow on cashew nuts and groundnuts. It has a little more carbohydrates and the different. You could have pista, you could have almond, you could have walnut, you could have Brazil nut, macadamia, all these nuts, and a little of cashew or groundnut. Okay, not a problem. I'm not saying stay away from it. Nuts, yes. Dry fruits, definitely no.
So one question that somebody's asked is regarding whether an air fryer can be used to make vegetables. So I think that's a little irrelevant to this, because the air fryers are used to prevent the use of fat. Yes. But here in this particular diet, we are not really advising that you have to cut down on fat completely. In fact, as Dr. Bhujang Shetty has mentioned, that you can actually use healthy fats in good quantities, like what we use, butter and homemade butter and ghee is actually very, very healthy, like what we've been hearing from our, ancestors. So you can go ahead and use it. I don't think you need an air fryer to really control your sugars, because air fryer is predominantly to cut down on your overall fat intake. So that would not really be
That was the mistake what we did some 40, 50 years ago, demonizing fats and glorifying carbohydrates. And that's why the world got into this position, sicker and sicker. 400% increase in diabetes and cardiovascular diseases right now. With so many hospitals, with so many doctors, so much of equipment, we are getting sicker and sicker. That means there's something wrong in what we advise. So this fat fear must go. See, when you air fry potatoes or this thing, that's still 100 times worse than eating healthy fats. You could use healthy fats. You need not do all this frying business. So eat till you're full. I'm not saying that go half stomach. Eat, make it very tasty. Eat to satiety. And maximum satiation comes from your fibers, from fats and proteins, not carbohydrates. Every time you eat carbohydrates or sugars, your sugar spikes, insulin spikes, brings down the sugar, there's a sugar crash, and within 2 hours, you're feeling hungry all over again. So that's the opposite with fats. There's absolutely no insulin response. There is no spike. So you get a constant flow of energy. That's why we say eat healthy fats. This we need to follow.
Yeah, and I also think it is important, not to go overboard with the fat. So we're not really recommending high fat. We are recommending healthy fat, but that's also in moderate quantity. Because there's one question saying that, what if my cholesterol go high? And there's another question asking in that, what is the quantity of ghee? I mean, I don't really think that's something, it's like an accompaniment to prepare your dishes. So there's not really a restriction, how much ever you need, 1 or 2 teaspoons to make your recipe or to make your, dosa or whatever else your preparation is. But beyond that, I think in moderation, I think it's, more than enough. There's one question that says here that the new macronutrient guidelines by Dr. V. Mohan on diabetes mentioned recently still emphasizes a carbohydrate intake between 49 to 56%. What is your opinion on this?
Definitely no. That's what's been debunked now. This is what the WHO recommendation is. Actually, official guideline says 49 to 50%. But the whole problem is you're not able to tolerate it. No wonder every time you go to the doctor, he keeps increasing your tablets. So the ideal way is around 10% carbohydrates. Your energy, 10% of your energy must come from carbohydrates, nothing more. So to get to this level, if you avoid sugars and grains, eat only green carbs, then you can definitely get to this, between 30 to 50 grams of carbohydrates every day. You will get into what is called ketosis. You will start producing ketones. Body will start running on fat, and you'll get all the benefits of fat burning. Otherwise, it's not going to happen. I don't know how many of people who have been treated with this 30-40% of carbohydrates have reduced their medication. You ask anybody who follows this whether their medication has come down. Medication is increasing. That means the process is still getting worse. So you need to get your carbohydrates to this level. This, if you follow, you'll get results.
So there is one more question. I think even that's an important thing. What to do if you hit a plateau? Like you've managed to bring down your sugars to 140, 150, and after that it's not coming down. So what extra do you do despite being on a low carbohydrate diet if your sugars are not coming under control?
No, there is some individual variation, definitely. The shorter the diabetic duration, easier it is to get back to normal. Longer it becomes a little more difficult. It may take more time. The body must recoup. So we really don't know. But only thing I advise you is just ask yourself, is excess of carbs getting in the way slowly into my diet? Am I taking something what I'm not supposed to? Or are you making even excess of protein also can give some amount of insulin response. So you can't have too much of protein also. Protein must form only 20 to 25% of our energy from proteins. That means an average person can eat about 100 grams of proteins a day. So if these two things can be looked after, and if you are following a healthy low carb diet, you'll have to keep doing it and see. I'm not saying that 100% of the people who follow this will completely reverse it. I'm not saying that. Definitely, first thing is your sugar will get controlled. Next thing, medicines will start falling away. But how soon you will get rid of all your medicines, we are not able to predict. That's an individual variation.
A lot of you all have been asking for how to get in touch with us. It is there on our website, and I urge you to log into our YouTube channel. A lot of what Dr. Shetty has spoken today are made into individual videos, also in Kannada, in English. So whatever works for most of you, we've spoken about how to go about this diet and how to sustain. We've spoken about smaller details, based on individuals' diet preferences also. I think we've managed to answer most of the questions. I'm sorry we were not able to take, small details like which dosa, when to eat, whether to eat jackfruit or not. So we've been able to answer. I've answered some on the chat as well. We've had lots number of questions. We've had close to 100 questions. And I think Dr. Shetty has done a wonderful job of explaining to you how to go about it. And I think we'll take one last live question. Mr. Ramchandrappa, are you there?
Yeah, he's there. Can you unmute yourself, sir?
Yeah, you can go ahead and ask your question, please.
He's muted.
Okay, if Mr. Anup is there.
Hello.
Yeah, Anup, tell me.
Sir, good evening, sir. This is Anup here. Actually, I'm following the RDC diet from past 10 days.
Yeah.
morning I have this 2 eggs with vegetables and all, but I'm not getting hungry only for the whole day. Is it okay or how it is, sir?
No, that's a blessing. That's what this low carb, high fat diet is all about. The way it works is that it reduces your appetite, it reduces your craving, and you automatically eat less. So the rule is don't eat by the clock. Eat hungry. Eat hungry. When you feel hungry, you eat. Don't feel deprived, but stop when full. And the very fact that your appetite has come down, that means it is working. So that's excellent. Just continue with this. You'll see how you will get fantastic results in a month or two.
Okay, sir. Sure. Thank you, sir. Thank you.
Mr. Deepak Kumar, please unmute yourself.
Sir, good evening. Myself, Deepak.
Yeah.
Last 2 months, I am going through RDC.
Yeah.
I'm completely changed my food structure. I'm going all these RDC food. I have met Krishna Pasar and guided us. So, but my morning, from that time, my morning sugar level is 170 around. And it is reduced now. But my HbA1c come down from 7.9 to 7.6. Not that much.
Yeah.
And post also coming down to 140. Earlier it is 180 like this. But my health level 3 kg I have weight loss. Weight loss in the sense mine around 57, I'm 54. Sometimes I am feeling weakness and chest also like some pain, not that much, means weakness feeling. Even when I am going for means walking, all the things I think some weakness like I'm feel. But completely I am feel good, means my hungry is not there. If I am taking food in morning 9 o'clock going for work and 2 o'clock there is no hungriness. And after 2 o'clock also I am taking 8 o'clock up to no hungriness. I am taking dinner like 7:30, 8 o'clock.
Yes.
All thing is good except my sugar level. It's and that medicine part, she has reduced my medicine to half. Means earlier I have taken 2 mg and 500 metformin morning and night 2 mg and 500. And that was still continued now. With this, I is concerned about my health, means maybe that less weight, all the things.
No, don't worry. I think you're on the right track, Deepak. You're showing fantastic results. See, the whole problem is body and all human beings, we all like status quo. What we are used to, it's not easy to change. The body won't so easily listen. It won't easily give up. It's going to disturb you for a few weeks, saying that, better to go back to the world and all that. But, you are seeing results yourself. And
Yes,
that
yes.
3 months average, especially that HbA1c, you have to wait for 3-4 months to even to be better, because it's a 3 months average one.
Yes.
Don't worry about these small morning and evening glucoses that go, that varies so heavily that it doesn't really make a big difference. So
Yes.
3 months average is very, very important. That you keep monitoring. What you're doing is fantastic. You just continue for a few more months and then you'll feel much, much better. All I can say is that.
Yes, sir. Means sometimes I think that reduce of diabetes, because I am suffering from last 15 years.
Yes.
So maybe my wife told it is not all sudden all people are changed, means yours also change. You don't worry about that. Whatever we are giving, we are know that it is very good food. I am not alternation. We are doing in that. You stick to that. Don't go for increase all this thing. So I am stick to that only.
I think we'll move on to the next question, because we need to wind up by 7. I think we've been able to answer a lot of the queries. One major query that I think we also discussed is that we're not really recommending a very high fat diet. We're just recommending a healthy fat diet, because there are some questions coming in that we cannot ignore high LDL. We agree with you. Our concept here is to basically go low on carbs, but not necessarily go very, very high on fat. We are looking at moderate but healthy fat. So that's a major message I think that we've been able to bring about. Thanks to all of you all for having participated. We've had great enthusiasm, and it's nice to see that the community is looking out to maintain their sugars, to reverse their diabetes, and to change their lifestyle itself. I'm sure we were able to throw light to answer a lot of your queries, and our chairman is available. We will be doing these programs in future also to allow more people from across the country or even out to participate, because I understand that live programs will be difficult for you all to come to the hospital and take part in. Thank you, sir, for taking time off. I think also you are a little unwell, so despite that, you were able to keep it going for an hour and a half. Thank you very much, and it's really appreciable that you want to change this concept that the community has regarding diabetes and its control.
Yeah,
thank you so much.
Chaitra. I'd like to thank also our team at RDC, Krishnappa, Dr. Kirti and his colleagues, the dietitians, all have played a major role and they're doing a fantastic job. I just hope and pray that we are able to take it to every nook and corner of not only our country, but the world. So good luck, God bless, and good night to all.
Thank you all.
Thank you.